This patient came in and he got a little, they tried to put an implant in here and failed. And he had a little plastic denture. So he wanted to get rid of the denture. So I cut the denture tooth off, glued it to the 2 teeth either side, took an impression, and the orthodontic lab made 2 wires here, and I glued them in place. Has anybody ever done that?
Yes.
Yeah. So he was very happy. This was his X-ray situation. These were the bite wings. See the bone loss there. And bone loss all the way around that distal root. What treatments would there be available for this patient? Aldo?
Razor flap and curate, scaling and curating and root planing.
Do you seriously think that distal root's got any chance at all?
Yeah, there's a chance is limited. Yeah, but
I would do endo, perio endo. Good endodontics. I think it does have a chance, but yeah. If I wanted to do implants, I would just put an implant.
You could always do the root canal treatment and wait and see what happens. And then if you need to, take off that distal root. So this was the plan. And this is what, I shouldn't really have that yellow interdental brush there because they're too small. They're very difficult to use. So this was the first visit. This was his bleeding index, but he'd already been doing some plaque removal taught by another dentist. So this is what I taught him on the first time. 1 to 2 weeks later, I checked toothpicking, checked the toothbrushing, or showed him the video and then showed him toothbrushing. How many of you scrub it in out like this? And how long have you been doing that, Aldo?
from the time I met you.
Do you need scaling behind your lower front teeth?
Or after probably 6 years or 7 years. Now I'm developing some calculus there. My assistants last week, they found out calculus developing. Now they want to do scaling for me. After 6 or 7 years.
I would suggest you might be more vigorous with your brushing there.
Okay.
I mean, I just have a belief. I mean, I probably have my teeth cleaned every 15, 20 years.
Okay.
And that probably is only to get rid of stain. You scrub in and out like this, Abby?
I started in 2020 when we started this whole lecture.
Good. Good. So another 1 to 2 months later, I gave a gum check, and he still had some bleeding. But I mean, he got deep pockets, so he couldn't clean down there. I then went on, this is after about 2 months before I showed him the interdental brushes. So I taught him the green one to start with. And then I checked the toothpicking, checked the toothbrushing, checked the green brushes. And then I gave him the mauve and gray together. I gave him 2 sizes this time because he was only using the gray one in about one place. So then another gum check, checked everything. He really hasn't changed much because he's still got pockets. I also recorded which brushes he used. So when he came in, I'd know what to check. So now, after about 3 months, the patient's ready. So this is scale and curettage under local anesthetic. Okay. And I talked to him about his lower left first molar, and he said, "What's the best thing to do?" And I said, "An implant." And placed an implant. Now, Ramford in the 1960s treated patients with a curettage in one quadrant, gingivectomy in another, and 2 different types of flap operation in the other 2 quadrants. And there was no significant difference. So who needs periodontists? Also, patients with intraperitoneal pockets were treated with curettage only on one side and grafting on the other side. And there was no significant difference. The only advantage in grafting is it keeps the periodontist busy. Next visit, so I did a scale and curettage on the upper right quadrant. I usually start on the right side because it's easiest. So, oh, by the way, how many of you have got sharpening stones for your scalers? Abby?
No, sir.
Ashwin? Eldo?
I have one which I bought from the local fish market, but I've rarely used it.
How many of you in the last month have scaled a tooth and heard the squeak? as you scale?
I did.
How old is your scaler, Abby?
It must be 7, 8 years, maybe 5, 6 years, maybe.
I'm amazed that you should get the squeak anyway. So these are the only scalers you need. The Gracey 1718S and the Gracey 1314S. They do everything you want to do. Has anybody got those? You have. Well done. What's happened to your other scalers? Have they been put in that bottom drawer? They have a tendency to creep out, don't they, Aldo? So, and how many of you got luxators? How many do you sharpen them, Tejas?
Not after every use, but I do sharpen them from time to time.
Yeah. I think the dentists who sharpen them or have them sharpened after every use are a bit obsessive, but I know I have a friend of mine who does that. So you need a sharpening stone like this. How many of you have a sharpening stone like this? I'd like the 4 of you to write a post-it to order a sharpening stone like this. I can't imagine it's going to break the bank.
Okay, we'll I tried ordering them in India, but it's not available here. So what I did is you get the sharpening stones at the local hardware. I reshape them to have a curve at one end where I can use it for my scalers.
Now you see, Eldo is coming over to England.
Oh wow! So please carry one from here though.
So if Eldo sends me a list of things he needs, he can also bring some toothpicks. Did you ever pay for those toothpicks, Tejas?
I thought I'll pay you in person.
Okay. So you don't have one of these sharpening stones, Eldo?
What is that?
You don't have one of these sharpening stones?
No, I didn't have.
Okay, so you need some emery cloth. Again, not expensive.
We don't get it as emery cloth. We get it as emery paper. Is it the same thing?
Sorry? Emery cloth, yes, same thing. I think I would prefer emery cloth.
I have not seen emery cloth as it.
So what did you say?
We get emery paper.
Emery paper.
You get emery paper?
Yes.
Yeah, okay. You can either use emery paper or emery cloth.
Okay.
Okay, you ready for this, Abby? So I put in local anesthetic, Buckley and Poutley. I personally would not use a greater palatine block. I don't think that's necessary. And I would curette out all the granulation tissue.
I think this would be a foolish question, but this has been a trouble for me all the time.
What's that?
I find it always difficult to realize which is the sharp side of the curate. Does anyone have the same feeling as mine, or it is just my crazy brain that is, you know?
I always get confused which side to use. I'm also not very sure.
That's it.
I try on both ends and see what is comfortable, and then
Yeah, but
straight it
I'm
out
not
and
sure
leave it
which
to
side
others.
is sharp.
Probably you need to go to Karansa again.
Now, our encyclopedia is here. He should be telling us.
Well, both sides should be sharp.
No, only one side is sharp. You know, it is curved in such a manner that it should adapt the tooth.
Yeah.
So I thought it's only my problem. So I never used to tell anyone.
You see this lower picture here? You're looking at the inside of the scaler. Okay, it's not a very good picture, but there's a sharp edge on the top of that, and there's a sharp edge at the bottom of that. Two sharp edges. You're saying it's not?
No, one side is not sharp. That is for sure. But it is difficult for me to find out which side it is. Otherwise, why should it have two sides? If it is.
No. If you sharpen it like I just showed you, it's going to be sharp at the edge of the scaler on the top of it there and the bottom of it.
Okay.
Do you mean that? No, I'm confused with the question. Is the question? It's a double-ended instrument. Which end goes where, or which end is sharp? Is that what you mean?
Yeah, which end is sharp? Which side is sharp?
Both ends are sharp. Depends on which side you're using for the particular side. Like it's curved in such a way that the same end can't be used both on the right and left side.
Okay.
So you have to use the right side for the right quadrant.
Okay. Anyway, I'll try it again and let you know.
I think he's trying to say the one side of the instrument has two faces. So this is, I think, what sir is trying to say, right, sir?
Yes.
So
Yeah. So one face, as such is it is sharpened by them.
For me, the problem is I don't know how to adapt it to the tooth surface. I don't know whether how to adapt it and then scrape it off, because
Yeah.
one side, the opposite side is anyway curved. That's not sharp. One end is not sharp. It's only the inner part that is sharp.
Yes.
No, it's
The
not.
outside.
It's the edge of the inner part. It's the edge of the inner part.
Yes. So the opposite side is curved,
If
which
this
is
is the
anyway not.
scaler,
Yeah.
it's sharp here and it's sharp here.
I'll have to go again and see it. I'm confused.
But at the moment, we're dealing with getting rid of the granulation tissue.
Okay.
Has anybody done a scale and curetting? Okay. And did you curette out all the granulation tissue to
Yes.
start with?
Yes. Yes.
Okay.
I try using all the sides and somehow get all the granulation tissue out.
Say it again.
I try all the sides of the instrument and somehow take the granulation tissue out completely.
Yes. And have you got a scaler like this? An excavator like this? I would then go in with an excavator like this, okay?
Okay.
What you're doing is changing a chronic infection into a surgical wound. Okay. So the body reacts. And if there's any granulation tissue you haven't got rid of, it's probably going to die anyway, because it's a surgical situation. This is the only scaler I think you need. Our dear friend Sebastian has about a dozen of these different shapes. Enough to drive you mad. So I then go in and curette with this as well. How much time would you allow for this appointment?
1 hour for a quadrant.
Yes. In the lower, I would allow a little bit longer because the local anesthetic takes longer. Okay. How many of you got ultrasonic scalers? Yeah. You got one, Abby?
Sir?
You
The
have an
voice-
ultrasonic scaler?
Yes, I do have ultrasonic scaler, yes.
Good. So then I would use the ultrasonic scaler. I would then root plane. You see the angle?
Which is this instrument that you're using for root planing?
How many
Same
instruments
scalers,
have
no?
you?
The same scalers. Okay.
You've only
Yeah.
seen 2 instruments.
Yeah. Okay.
Right.
No, I just got confused after you said of ultrasonic scaling.
Yeah. And now I root plane. Okay, and this is where you hear the squeak. Classically, they say you should go up and down the tooth 20 times. Eldo, do you see the angle of the instrument?
Yes.
Then I'd use the 1718S.
Just to clarify, so you'll run when you're removing the granulation tissue, would you run it? Would you run it along the soft tissue, or you just run it along the tooth?
I would just feel for granulation tissue and just scrape it out. You're just scraping around. You're not necessarily you wouldn't be going up and down the tooth, no, because there's no granulation tissue attached to them.
So would you like, suppose if this is the soft tissue, would you run the scaler like that? Would you run the scaler like that along the soft tissue?
You just
You rub it
find any granulation tissue and
just remove it.
just
Okay.
remove it. It's just a crude curettage.
Okay.
Okay, anywhere you can feel any granulation tissue, you scrape it out.
Okay.
Okay. Okay, so let's just go back a minute. You firstly get rid of the granulation tissue with the 1718S and the excavator. You then use the ultrasonic scaler on the roots of the teeth and the Gracey 1718S and the 1314. Then you go back in again and curette.
What is
Any
it? Continue till when in root planing? What is the last thing that you mentioned? Continue till scraping goes, the squeaking goes on.
After you've done the root planing.
No. Can you go to the previous slide? Previous one. Okay. Got it. Continue till the scraping sound is gone.
Yes.
Yeah.
It's a squeak.
What does that indicate actually?
Well,
All
you've
the
got rid of
roots is
all
gone.
the calculus. You've got a smooth tooth.
Okay.
The bacteria are less likely to stick to a smooth tooth.
Okay.
Calculus itself doesn't matter. It only allows plaque to stick to it. So now you've done all the scaling. You can then find sometimes a little bit of granulation tissue still. And I would then use the ultrasonic scaler again. Postoperatively, explain to the patient that they may not be able to clean in that area very well. For a week or two. It may be sore. So 2 weeks later, you start the patient back on cleaning the area. They may, at this stage, need wider incidental brushes. 1 month later, you check how they're getting on. You do a gum check. And you check their cleaning. You see how much better the upper right is. And you can show this to the patient. It helps motivate. Okay. Next visit, scale to curettage upper left and remove the upper left second premolar, which was very loose. So explain to them they're going to be sore again. See them 2 weeks later and suggest wider interdental brushes up there. 1 month later, check the scale and curettage, do a gum check, and check the cleaning. Then do the lower left quadrant 2 weeks later, 1 month later, and then finally the lower right quadrant. Now, I'm sure that you have some patients who are good patients who'd be interested. You just need to be able to have the attitude that this is the best thing to do. So he's now down to 3% bleeding. And these are all the different brushes that he's using. So it's not a case of the patient coming in and saying, oh, which ones do you use? Where? You've got a recording of the ones you use, okay? So next visit, I put a screw implant in the upper central incisor region. And I relieve the top of the, obviously you have to take this off, the tooth. And it's a bit of a pain taking it off and putting it back on again. You also have to make sure it's not touching the implant. So there's no stress on the implant. You've now gone down to 0. I gave him an estimate for a sinus graft on the upper left. I checked the gums, checked the brushing inside the lower front teeth particularly. People need constant checking on their cleaning. They don't just learn how to do it and then do it. So then we discussed this tooth. Patient was offered a root canal treatment of the mesial canal, removal of the distal root. I believe there was, just 1 second. I believe there was pockets all the way around this. I can't see that this is going to be, it's going to be surviving just by doing a root canal treatment. I don't think. He wanted a proper job done, and I think that an implant is the proper job. So I did the sinus graft on the top there. This is before, and that's after. You can't really see very well. Irradiated bone, cancellous bone doesn't show up very much. You're still worried about doing sinus graft, Teldo?
Yes.
For what reason?
I don't know. Long time I've done sinus grafting. I used to do in the beginning without any fear, but abstinence from that has produced this fear, I suppose.
I mean, what do you do for a patient like this?
I try to frighten them about sinus grafting.
Sorry?
I tell them sinus grafting, or I try. In this case, I would try to go for a smaller implant.
You've got about 4 millimeters of bone there.
Yeah, I can do an indirect sinus graft and make it into 6 and put in a 6 mm implant.
I personally preferred 2 implants for a molar with it's got 2 roots on it, so put in 2 implants. I preferred that to a large diameter implant personally. Do you see what's happened? I hadn't taken bite wings once a year. This was what he was like 1 year and 4 months before. So he ended up having these root canal treatments. Do you take bite wings now, Abby?
Sir, actually, patients are too aware of the fact that there's a lot of radiation with one X-ray. So whenever I always tell them that we need to take bite wing X-rays, and patients usually are not ready. So they just say take just one X-ray, which is required, and that's it. So I only take periapicals or yes, these ones. So I haven't taken bite wing till today.
Are you
You've
worried
got to
about radiation?
You've got to educate your patients about the wrong notion that they have about radiation.
Yes, I do. I do always, but they tend to, be adamant about the fact that radiation does this, radiation does that. So,
And they use an iPhone, right?
Sorry?
They use their iPhone, right?
Yes.
And the cell phone. So
Yes, yes.
you can tell them that a full mouth bite wings, full mouth X-rays is like using your iPhone for 1 week.
Okay.
It gives you the same radiation.
Okay. Okay, I'll tell this as an example. Yes. Okay.
Many times you can just go over and I don't know if you really need to give so much detail. You can also just tell them you have to take few other X-rays and just to see if there is any other decay. And I mean, maybe some patients would reject it, but many would take it. They won't have a problem, I would say.
I'll try more this time.
Yeah.
I think this is a lot. Eldo, are you taking more X-rays now?
Yes.
I think it has a lot to do with the confidence with which you project.
Very true.
If you sound very doubtful when you're talking about needing more X-rays, then the patient's not going to be convinced. Or rather, he'll be doubtful of you.
Correct.
It's about how confident you are when you recommend X-rays.
Yes.
Are you still concerned, Aldo, that they're thinking you're trying to make money?
No.
Good.
No.
Good. I mean, to me, the scan curettage is just a routine procedure for patients with pockets over 4 millimeters. So if that patient had come into your clinic you wouldn't have done a scale and curettage. Would you, Eldo?
Yes, I will do.
Sorry?
I will do.
No, would you have done?
No, I wouldn't have done before.
You see, in the UK and America, you'd be in serious trouble putting implants in without. Let me know when you do your first scale, your next scale and curettage. Okay. But don't do it until you've got the patient cleaning really well. We're going to finish now, but Ashwin, Tejas was asking me whether we produced any program for training staff. I need to check. You got that presentation on the numbering of teeth, have you? Tejas?
Yes.
Eldo, do your two new members of staff know numbering of teeth?
We had just started teaching.
Have you seen my presentation on it?
No.
I'll send it to you.
Yeah, please.
Yeah, we definitely need a sort of system whereby you've got a checklist of things to go through. I'm sure I started one. Things like how to address the doctor, how to address patients, how to dress. We should be able to develop a checklist of things that you go through. Yeah.
That would be really helpful, actually.
Yeah. Okay. Right. So we'll see. We'll perhaps have that for the thing next week.
Yes, about how to address the patient. Today we had a patient who took offense when my assistant addressed a child patient as a patient. So she immediately told my assistant, don't call her a patient, address her by her name. So, and then I had to talk to my new staff about how to address patients and what people expect.
Yes. Yeah. Okay, so we'll thank you for attending. It encourages me when I got 4 people like this anyway. It improves the dynamic. Okay, I'll talk to you again soon. Think
Okay,
STEM
bye-bye.
curettage, okay? Cheers,
Bye.
Aldo. Cheers,
Cheers,
Abby.
bye.
Ashwin.
See you.